Teakin.
Hi, my name is Jasmine Thomas.
Earlier, we talked about the causes of hypertension and a little bit about salt sensitivity. Not all hypertension is created equal. People vary in the way their bodies are able to tolerate salt. In particular, there are a few categories we can designate. Salt sensitivity is defined as an elevation in blood pressure in response to high salt intake. Salt resistance is defined as a minimal or no increase in blood pressure in response to high salt intake. Inverse salt sensitivity is defined as a paradoxical decrease in blood pressure in response to high salt intake and an increase in blood pressure on a low salt diet. Jasmine, how common is salt sensitivity?
Based on previous studies, we estimate that 16% of the American population are hypertensive, salt resistant, 12% are hypertensive, salt sensitive, 14% are salt sensitive, normotensive, 12% are inverse salt sensitive. 46% are normotensive, salt resistant. However, these aren't cut and dry categories. These categories are a continuum of characteristics where one person may be slightly salt resistant and another may be high salt sensitive. As you can see in the Kaplan-Meier graph, the y-axis indicates survival rate in a test population and the x-axis shows how long the study was conducted in years. If the curve is flat at the top of the graph, then no one has died. But if the curve hooks down and to the right, then more patients have died. The most important takeaway message from this landmark study is that you can be either hypertensive or salt sensitive and reduce your lifespan by 20 years. In other words, salt sensitivity lowers survival independence of blood pressure. The only group on the graph with a significantly higher survival rate was the normotensive and salt resistant group. However, salt sensitivity may not result in a shorter lifespan if one maintains a healthy lifestyle by reducing salt consumption and maintains low blood pressure through both diet and exercise. What does this have to do with genetics and the kidney systems we talked about?
So based on the previous studies, we're trying to find correlations between a genetic relationship and salt sensitivity. We found the genetic variants GRK4 and SLC4A5 take a part in the regulation of sodium intake. Our SALT study is testing how certain genetic variants in GRK4 and SLC4A5 impact salt sensitivity in individuals who are hypertensive, non-salt sensitive, hypertensive, salt sensitive, non-hypertensive, and inverse salt sensitive, as well as normotensive. Salt sensitivity is its own risk factor for cardiovascular events, just like high blood pressure or family history. That is to say, people with normal blood pressure who are salt sensitive are still at risk for cardiovascular events, or that hypertension alone is not the only piece of the puzzle.
As we've said in other videos, our lab is looking at the genetic variants in GRK4 and SLC4A5, one of whose protein product interferes with the dopaminergic pathway in the kidney, and the other whose protein product acts as a sodium bicarbonate cotransporter to move salt back into the bloodstream. Certain genetic variances could cause salt sensitivity.
By learning more about how hypertension interacts with salt sensitivity, our lab will enable physicians to choose the best treatment plan for hypertension with a combination of diet and drugs, and will help drug development. If you choose to enroll in this study, you will have the chance to learn more about your body's relationship with salt, as well as blood pressure. Thanks for listening.